Cool. Mhm. Welcome, everyone, to today's Pain Awareness Month Live titled Cannabis Care. I'm Emma Chasin, a research scientist on the OCM Health and Safety team, where collectively we are tasked with managing and educating individuals on the medical cannabis market in New York State. We thank you so much for tuning in live as we speak with some prominent physicians who have over a decade of experience in utilizing cannabis treatment to assist patients with lasting chronic pain relief. Last Tuesday, New York State took a big step forward by approving cannabis research applications, further establishing this state as a research pioneer and affirming that cannabis is medicine. For many researchers, scientists, practitioners, pharmacists, patients, and caregivers, this is a welcome update that represents an opportunity to study and collect the evidence needed to better understand the vast potential of this plant. We wouldn't be where we are today without the pioneers in cannabis research who have paved the way. Decades ago, when regulated public access to cannabis did not yet exist, researchers, scientists, and physicians risked their careers to study medical cannabis so that they could help their patients. During the AIDS epidemic of the 1980s, the LGBTQIA+ community, disproportionately affected by HIV/AIDS, had little help and few options for effective treatment for pain caused by the disease. Trailblazers like Dr. Donald Abrams began researching and administering community-based cannabis care to assist patients who suffered with neuropathic pain caused by the virus. What his research showed was outstanding. Cannabis effectively relieved neuropathic pain in HIV-infected individuals and also assisted patients with nausea and mood improvement. This research played quite a crucial role in establishing cannabis as medicine and contributed to the fight for medical cannabis legalization in the 90s. Since then, research has been published on cannabis's potential therapeutic role in the management of many types of pain: nerve pain, chronic pain, muscle pain, cancer-associated pain, and we do have a good amount of evidence that suggests that cannabis may help patients find relief. Today, practitioners across the country are discussing medical cannabis with their patients and exploring the potential benefits of this plant for a variety of conditions. Right now in New York State, over 4,000 practitioners and over 120,000 patients are certified under the medical cannabis program. Our aim is to continue to educate the community on the collective research evidence that has been done and continues to emerge regarding cannabis medicine so that those who may benefit from this plant feel empowered to engage in discussions with their providers. Before we introduce our two fabulous panelists, I'd like to provide the disclaimer that the views and opinions expressed in this live event are those of the speakers and do not necessarily reflect the views or positions of the Office of Cannabis Management. The Office of Cannabis Management makes no claims, promises, or guarantees about the accuracy, completeness, or adequacy of the contents and expressly disclaims liability of the opinions expressed. The appearance of these speakers is for the information and convenience of the public and does not constitute endorsement, recommendation, or favoring by the Office of Cannabis Management. It is an honor to have such brilliant practitioners here today to discuss medical cannabis and its role in pain management. Many of the patients certified in our medical cannabis program look to cannabis medicine for help with managing pain. So I'm really excited to hear the insights and experiences of these two experts in the field. So without further ado, let's get started. First, here with us today, we have Dr. Shah. Dr. Shah is a leading pain medicine physician practicing in New York City and Long Island. For the last 12 years, she has specialized in treating chronic pain, and her work broadly emphasizes engagement with innovative treatments with the goal of empowering her patients. As a certified New York State medical cannabis practitioner, she has utilized the benefits of cannabis treatment to treat neuropathic, somatic, and nociceptive pain and sustain relief. Her continued interest in the medicinal benefits of cannabis has led her to become a leader in researching microdosing and creating reproducible algorithms to reverse the endocannabinoid deficiency and help diminish pain. Additionally, she has been safely and effectively helping her patients transition off synthetic prescription opioids with cannabis treatment. With countless accolades and recognitions, such as the 2023 Women in Medicine and New York Magazine's Top Doctors of 2020, we are honored to be able to speak with her today. We are also joined by Dr. Grace Forde. Dr. Forde is a medical director of neuropain and is the current president of the New York State Pain Society. As part of her research, she has conducted multiple clinical trials assessing the safety and efficacy of medications for the treatment of headache and various neuropathic pain syndromes. She has also published articles on neuropathic pain, myofascial pain syndrome, cannabis as medicine, and migraines. Her great interest is in medicinal cannabis as it relates to treating different pain states. Dr. Forde is board certified in neurology and pain management. She has written and co-authored articles and book chapters on a variety of subjects, including the treatment of migraines, trigeminal neuralgia, postherpetic neuralgia, myofascial pain syndrome, diagnosis and treatment of low back pain, and medicinal cannabis and pain. We are so very grateful to have both of you here today. Thank you so much, Dr. Forde and Dr. Shah, for taking the time to speak with us.
Thank you for having us.
Such a pleasure. So I'd like to direct this first question to both of you. Really, all of these questions will be directed to both of you. But Dr. Forde, I'll ask you to start here. Why did you choose to specialize in pain management?
Well, I'm a neurologist by training, and I did my training in California and San Diego. And during residency, we saw a lot of patients with nerve pain. And the problem was that a lot of people did not know how to treat these patients, nor did they want to. So I decided to dedicate my career in treating the pain, alleviating the suffering, and improving the quality of life. So that is one of the main reason why I got into pain management.
Amazing. And Dr. Shah, same to you. What made you get your start in pain management?
You know, pain is a very difficult thing to treat. And, I'm a board certified anesthesiologist. So for us, our care and the rapport that we have with our patients is very short. We deal with acute pain, post-operative pain. And, I remember, a couple of different instances, some of my chronic pain patients was very hard to treat, to get their pain under control. And the more I delved into it, I just felt that this field in general has so much innovation, and it's definitely come a long way. People are living longer and they want to be pain-free. So I ended up choosing this route.
Absolutely. That's amazing. And we know, as I mentioned, that a lot of our patients in the New York State Medical Cannabis Program use medical cannabis for effective or more effective management of their many different types of pain. And so, Dr. Shah, I'm curious when kind of you became interested in cannabis as medicine. When did that kind of cross your mind as something to pursue in your practice?
Yeah. So basically, for me, my eyes really opened to medical cannabis. I did my fellowship at Sloan Kettering, and I work with a lot of cancer patients. And at that time, I believe it was in 2010, New Jersey was approved for medical cannabis. So one of my mentors was, basically I was working very close with him, and he was prescribing it for cancer pain at that time. So I got to learn and understand the protocols that he used, and how he basically was able to help a lot of the neuropathic pain, the nociceptive pain, and also the anxiety component that came with these diagnoses of cancer.
Mm-hmm. And Dr. Forde, when did you kind of get your start, or your interest was piqued, let's say, for cannabis as medicine?
I did my pain management fellowship at the University of California, San Francisco, and I was there from 95 to 97. Medicinal cannabis, as well as recreational, was approved in California in November of 1996. So that is my interest. So I've been in this space since 1996, or before that, actually, when it was approved. And they had we would write prescriptions, whatever the diagnosis was, and the patients would go to these facilities and they would get, whatever edibles or whatever to treat the pain. So I've been in this space since 96 in terms of treating patients with medicinal cannabis.
Wow. Oh my goodness. So that's, close to, 30 years now. How have you seen it evolve since you first started working with medical cannabis?
Well, there's been greater acceptance, I would say, more so with patients versus healthcare practitioners. The patients usually come to us or come to me and other physicians, because other physicians refer to me because they say that their patients come to them for medicinal cannabis, they're not comfortable with it, so go see Dr. Forde. So that is one of the things, mission two, that I have, is to educate other physicians, because I think a lot of us, more of us, need to get into that space. So I've seen greater acceptance by the patients. Patients want to be on, quote unquote, more natural remedies, more so than the traditional medications that we have here in the West. And that is the biggest shift that I've seen. Also, in terms of more research out there, not as much as I would like, but the research is also growing, which is very, promising.
Definitely. And very, exciting to see kind of the emerging evidence that is coming out with regards to more protocols, I guess, for the applications of medical cannabis through different dosing regimens for different types of pain. Dr. Shah, in your clinical experience working with patients, as Dr. Forde mentioned, have you seen this greater acceptance of patients, or this greater curiosity around medical cannabis?
Definitely. I see people exactly come in looking, for answers, to help them with the pain. And usually by the time they're seeing a pain management doctor, they've seen multiple doctors, and they've gone to a point where nothing is helping them. And sometimes they just think that they're losing their mind and they have real pain. And, when it comes down to it, when they've failed surgical options and they've failed, traditional medical medicines, this is what they're looking for. And, we've seen such great progress and success with it.
And how, to both of you, but Dr. Shah, you can start here. How do you approach that conversation with your patients when, they're curious about cannabis as medicine? Is that something that you found that takes some easing into, or they're just, different types of patients with different levels of acceptance or excitement around this potential opportunity?
No, that's a great question. What I've noticed, I have a older population, and a lot of my patients are from their, let's say, 40s to hundreds, and I've noticed lately more over the last, let's say, 5 to 10 years, that they're now looking for different options besides a muscle relaxant, besides an anti-inflammatory, to a point where nothing else is helping them. And when CBD and THC started to come more into mainstream, and the patients are asking, yeah, I heard about that. What is that about? And you go through the science, and you explain to them what the endocannabinoid system is and how we have these receptors in our body with CB1 and CB2. And they try to understand, and they feel like, okay, well, this is something that I want to try. The hard part is that when you start saying, you explain to them what THC is and the difference between CBD and THC. Sometimes it just takes them a couple of seconds to say, well, let me speak to my family about it. Let me think about this. Let me research it a little bit. And that's when, they come back and they say, well, let's try some physical therapy. Let's try this. And then they come back like, you know what, they'll give you a phone call like within a couple of days. I am actually interested in I'm really serious thinking about it again, So sometimes some patients, I'm not sure if it's the right thing, and that's why I usually call their primary. I'm like, who knows you the best? Because nowadays, a lot of the patients see multiple doctors, and I always try to find someone that they've stuck with so they know, what their daily ins and outs are, what kind of mental state they're in, what they take and what they do every day. So I think that's also important, because the communication between providers is really how it's going forward as far as research is concerned, that everyone's on the same page and they understand that it's going to help.
Absolutely. And I love, your mentioning of just, it's an option on the table. It's not necessarily great for everyone, but it's something that is an option to be explored if appropriate. Dr. Forde, would you say that your experiences with patients are kind of similar in approaching that conversation around medical cannabis?
It is similar. What a lot of patients I find come to me so that I can put their mind at ease, and I remind them, or I tell them actually, that we have cannabinoid receptors in our brain, in our eyes, in our internal organs, joint, bones, from head to toe and every place in between. And I also mention to them that the endocannabinoid system is like a stress response. When this body, this organism we call our bodies under stress, reproduce cannabis. A lot of people don't know that. And as quickly as it is produced, it is metabolized, and it brings the body back into what we call homeostasis. So I try to explain that to them. I also explain to them something that they know about, something called runner's high. When patients get runner's high, they're in the zone, and everybody said you're producing, endorphins. You are, but that is only part of the picture. The other part is a substance called anandamide, which means eternal bliss, which is a cannabinoid. So I try to explain to them that the system, the thing that they're afraid of, because some patients are, it's already in your body. We produce it, we have receptors for it, and it is natural on that level. And so they said, gee, I didn't know that. And that really takes a lot of the sting out of it, and the patients are more accepting of it at that point.
Yes, I love that strategy of it's something that is natural to us, that we all have our own unique endocannabinoid receptor systems. And this plant also happens to have cannabinoids that can interact with that system to just bring us back into balance, which I love. I'll open up this question to both of you, whoever would like to kind of jump in. After your patients have been, experimenting or engaging with medical cannabis for a while, do you have any, stories to share around the impact that it's had on your patients' lives?
I'll start off. I've noticed that I do a lot of pain management, as does Dr. Shah, and a lot of the patients are in opioid therapy. And something I tell the patients, I said, once you start this treatment, we will start initially to maybe, taper and discontinue the opioids. And I have had several patients that when they come back to see me, they said, doc, I'm only taking, like one pill of the opioid, whereas they were taking 3 or 4, before. And they themselves start to wean themselves off the medication without me even telling them how to do it. And there is evidence to show that once you're on cannabis, all the side effects of coming off an opioid is lessened. And so that is one of the things that I find. And there's also evidence to show that when you're taking cannabis and you're also on an opioid, which some people are afraid to do, but there is really what it does is that the opioid, the cannabis, excuse me, shift the curve to the left. What that means is that whatever opioid you're taking, if you have cannabis on board, it makes that medication even more effective. So if the patients were not getting pain relief before, now they'll get added pain relief, or now they can decrease the opioid and get the same relief or even better relief now that cannabis is on board. And that is something that I find. So I've had a lot of patients, if they cannot come off their opioid, they've cut down significantly by 50% or more, which is something I really, like, given the opioid crisis we have in this country.
Yes, I definitely agree. I've been seeing very similar results. A lot of my patients find that it helps them with sleep more than anything. I think when they look at the ratios, I like to start the patients very slow, and I like to let them know that it takes time. Some patients don't understand how fast, they think they take it and they're supposed to feel something and they're waiting for something. And I also try to look at what medications they're on, because there are different medications that some of my patients, especially patients that are on blood thinners and patients that are on certain medications that may interact, especially with the CBD. So I always go through, that's why I always like to talk to their primary, be like, I want to start the patient on this. Do you have any reservations? Because last thing you want is another, an issue with the patient. But as far as the sleep is concerned, I definitely have been able to bring down patients off of sleeping agents such as Ambien or Trazodone, where they no longer need it. And definitely, I've seen, very similar 50% reductions in narcotics. The patients, that I feel that have a morphine equivalent of 90 and less, they definitely are bringing it down. The ones that are higher than the morphine equivalent of 90, sometimes it's a little bit harder to get them completely off of it, but I feel like they're on the right step. So, the best thing about the medical cannabis is that it gives a great pain relief for neuropathic pain and somatic pain. So when they look at and you add different ratios of CBD and THC, and I always like to start a little bit higher with the CBD, because I feel like most of my patients have a lot of neuropathic pain from a herniated disc, or have chronic pain from a failed back surgery, where they're continuously having to take other neuromodulators such as gabapentin or Lyrica. And when I start to increase the dose and starting at a higher ratio of 20:1 of CBD to THC, I've noticed that they have been able to come off some of those neuromodulators. So I always like to go slow and really, speak with the patient and manage their expectations, to check in with them to make sure, because I think when, let's say, we have a 70-year-old lady with severe arthritis, which is not a surgical candidate, does not want to go down the narcotic route, but is willing to try medical cannabis. It really is a great opportunity to really help that patient. And I think the slower you go and just checking in, they feel like someone is monitoring it. Some of my patients at times do feel some reservations going into some of the dispensaries, because it's not like a regular pharmacy, and they get overwhelmed with the choices that are there. And the way that the New York State prescription is, it makes it easy for us, so we can kind of guide them on the prescription of what to ask for and what to write. But sometimes it's also frustrating to the patient when they want to try something and it's not written on the prescription. So it's like a, kind of a balance, trying to figure out the right dosing for them. So I think for us, it's really, I always like to start my strategy, just go nice and slow and give it time.
Definitely. And Dr. Shah, as you mentioned, cannabis is not a one size fits all, due to all of the chemical compounds and the various ratios and product forms, as well as the way that it will interact with each patient's unique physiology. Dr. Forde, I'm curious if you've found, any particular strategies or cannabinoids or product forms that you've seen to be most effective for reducing pain in your patients.
Yes, to pick up on that point too, the plant itself has over 500 chemicals in it. And one of the drawbacks, the fact that it's Schedule 1 federally, is that we cannot tease out the different components in order to treat pain or anything else, for that matter of fact. So right now, for sleep, which Dr. Shah mentioned, most of us or most people use THC for sleep. But THC is also the component of the plant that can get you euphoric and high. But there's a component of the plant, the CBN, which is also promotes sleep, but it does not get you high. So things like that we need. So if we can get a product that is more CBN based, more so than THC based, the patients can get sleep, and they wouldn't get the high, which is what a lot of people are trying to avoid. Because if they're trying to get high, let's face it, they'll go on the street. They're not going to come to see me or Dr. Shaw. There is also the CBC product, and the CBC product also helps with analgesia, as does the CBD, helps with arthritis and inflammatory type pain. So there are different types of medication that if we can get our hands on more specific parts of the plant, and I think they have a little bit better products on the West Coast, but we're getting there in New York State, then we can prescribe something while minimizing the side effects that would help the patient.
Definitely.
Yeah,
And, to your point of all these emerging cannabinoids, terpenes, flavonoids, I'd love to shift our conversation a little bit into research and ask both of you if there's any, given the current body of research that exists regarding cannabis's potential to reduce or relieve pain, has there been any interesting or recent developments that you feel like, okay, here are some, potential breakthroughs for the field, or even something that you've integrated into your practice or understanding of cannabis to be able to better help your patients?
Do you want to start?
Sure. It's very hard because there's so much research that's coming out, and on my feed I always have anything with cannabis. It just comes right up with any article. So I always like to sift through and see what's there. The hard part is that all these research articles, we haven't really had our fingers on the perfect one, in the sense like, okay, this is the gold standard. We're always looking for randomized, blind, placebo-controlled clinical trials, but unfortunately, it's not like a cookie cutter type of thing. Now, after all the things that I've looked at, and I like to look everywhere, because I feel like when we do, these researches, it's very important that we look at all different countries. I feel like there's not as much politics. There's not that much, there's so many different sort of input that we get and based on it. So the one of the articles that really stood out to me was from the Journal of Cannabis Research. I think it was in 2021 in July that came out, and which was really based on recommendations for dosing and administration of cannabis with pain. And it was called the modified Delphi process, and that's something that they had some really great a really great sample size. They really focused on a great algorithm of how to start, what they're looking at. And, it was from the US, Germany, California, Europe, so it gave us a really good broad amount from physicians that have been prescribing it and what their research has shown. So that's really probably one that I thought was really great as far as looking at all different aspects, and understanding how to really apply it clinically.
Absolutely. Yes. I know that that's a big kind of gap in our knowledge right now, is that application clinically in terms of defined dosing regimens. Dr. Forde, I want to give you the opportunity to share any, research. I know that you have an extensive background in research, so any kind of new current cannabis research that's come out that has felt inspiring to you.
Unfortunately, I can't say anything that is totally inspiring, because, as I said, we said before that, the dosing is what patients want. Patients are used to telling them take one pill 3 times a day or what have you. And unfortunately, we do not have that type of evidence right now in terms of cannabis. It's not a one size fit all. Patients have to be very individual. I tell patients my pain is different than yours, and even their daytime pain is different than their nighttime pain. So what I try to do is I use a lot of the liquid in terms of cannabis, and I try to vary the ratios of THC to CBD so that they can address their pain at different times of the day for different pain intensities. So in terms of dosing, I haven't seen anything that I can point to, because unless we can really take apart the plant and do basic bench research, randomized clinical control, double-blind, placebo-controlled trials. We don't have that kind of evidence. And so that is my big peeve right now, pet peeve with the whole industry. We have to get it off immediately, Schedule 1, so that we can do the necessary research, so that we can really realize the benefits of this plant.
Absolutely. And on that vein, Dr. Shah, has there been, research that I know there's been a lot of research that hasn't been explored, but do you have certain top topics that you would like to see with regards to cannabis's, therapeutic potential for pain management?
I think one of the biggest things I'm interested in is the genetics and the physiologic factors of the patients, because I feel when we look at the CBD and the interactions with the medications like clonidine and Coumadin and all these medications, and you look at the patient profile and you look at the disease process, it has to come down to, the long-term effects with the dosing and the titration. So it's really, if we can genetically say, okay, this is, we understand the metabolism, but, like Dr. Forde said, really picking apart the plant and using, we see different strains, these hybrid strains, and in certain patients you will get great relief with it. I also, it's also the type of, as far as the pain component, how fast does the patient need the relief? If they're taking an edible, it's not going to kick in for, at least 2 hours. So you have to be cognizant of the pain. If it's something that's, associated with physical therapy or a dressing change, they need something more immediate. So, understanding the different ways of applications of the medical cannabis, and also, another, research aspect of the interaction with medications. I think, as much as we would like, for patients not to be on medications, we have an aging population, and especially in the pain world. And so, our medication list keeps going up, and we want to make sure we don't, cause any bad side effects.
Definitely. Yes. And same question, Dr. Forde. Any particular topics in research that you'd like to see emerge over the next few years?
One of the most vexing things to treat in pain management is nerve-related pain, neuropathic pain. And so I would really like to see a lot more research in that. We have a lot of evidence that it works in fibromyalgia and different pain states like that. But nerve pain in particular is still very troubling and very difficult to treat. So I would like to see more research along those lines, and what ratios of THC, because you do need, from my experience and the research I've seen, you do need some THC to treat nerve-related pain, but there's a balance between getting enough pain relief and getting the euphoric side effects from THC. So that is a balancing act that we need to sort of figure out, and that is where I would like to see a lot of research is focused.
Definitely. So we only have a few minutes left. So I'd like to shift to some questions about engaging the clinical community about medical cannabis. Both of you are certifying practitioners who certify patients for cannabis in New York State's medical cannabis program. I'd love to hear, Dr. Forde, of your experience as a certifying practitioner in New York State, and advice that you'd like to offer to your clinical colleagues working in pain management, who may be curious but hesitant about medical cannabis.
It's shifted. In the beginning, it was very dismissive, well, you do that cannabis, I wouldn't use terminologies here. And so they made it feel like it wasn't anything that could benefit the patients, or it wasn't like real medicine. I have seen a shift now where more practitioners are coming around. They're not doing it themselves, but they're referring the patients to Dr. Shah and other practitioners and myself. So I have seen that shift, and what I think is really needed is for physicians to educate themselves about the plant itself. I think we need to start with basics. Educate yourself about the plant. And once they do that, then we can start, their eyes will be opened as to see, oh, gee, if this has this benefit, anti-inflammatory, oh, maybe it would help my patients with inflammation. It has an anti-spasmodic effect. Maybe it would help my patients with, with muscle spasms or what have you. So I think basic education is what is needed for the practitioners out there, and that would translate into them becoming practitioners themselves or continuing to refer to patients like myself and Dr. Shaw.
Yeah, I agree completely with Dr. Forde. The hardest part is like, you get this like look on their face when the patients ask them, and I've seen it on a lot of my internal medicine colleagues where they're like, well, I don't do that, and they get a little bit uncomfortable. And so, I think having, more talks like this, and also more, CME related activities, talking about it, because you'd be surprised how many practitioners don't know about the endocannabinoid system, and they look at you like they're looking at you, but you can clearly know that they don't really understand it and don't feel comfortable talking about it. And there is so much research out there now that proves what we already know, and now that we need to really focus on getting everyone on the same page, from the mid levels to physicians to people in the emergency room, because what happens is the dentists or people have acute pain, they end up taking a narcotic, they end up going down this rabbit hole, and there's things that we can put in place, and that's what I want to see. I want to see in the pain sort of stepping ladder to find how we have anti-inflammatories, how we have muscle relaxants, how we have neuromodulation. I want to find a stepping stone for medical cannabis, and to have it part of an algorithm from every person, coming in from an urgent care to a private practice office and feeling comfortable. And that day is going to come very soon.
And just to expand on that, I think where we need to start is medical school. I did not learn about the endocannabinoid system in medical school. I had to teach myself about it. So I think we need to start off in medical school. And once we start there, then we can change the culture. We can shift, maybe 20 years from now, about 10 years from now, maybe not that long. But, with every new class that are graduating, they will be more open to it because it's something they would have learned in medical school. So I think that's where we need to start.
Definitely that education just legitimizes this as a medicine, as something that has at least an impact on physiology that should not be ignored. Thank you both so much for being a part of this education. This is a good step, in beginning to just educate the greater community about cannabis's therapeutic potential. So really, thank you so much for joining us, all of you for joining us, and of course to our two amazing panelists for joining us today to commemorate Pain Awareness Month. Every day we are working to fight that stigma, expand access to medical cannabis, improve the experience for patients, practitioners, and caregivers, and provide that research and education about the benefits of this amazing plant. So thank you all again for tuning in. And for any other updates, please follow us on social at NYS_cannabis.
Thank you.